Okay, so today I'm going to be showing you how to do a sterile wound dressing. So first we're going to start with our K-wipe. So I'm checking my physician's orders. I'm checking for allergies. I'm assessing my patient and assembling my equipment. I'm going to wash my hands, introduce myself, and identify the patient. I will provide for privacy, and I will educate, explain, and evaluate any procedures. So, first thing I'm going to ask is if my patient is in any pain. On a scale of 0 to 10, what is that pain and how are you feeling? If there's any medication for pain, I'll administer that 30 minutes prior to the wound dressing. So, here I have my wound, which already has a dressing on it. So, I've washed my hands. I'm going to go ahead and gather all my equipment. So, I have my sterile case, my gauze, my dry gauze, my tape, which I've already pulled and placed, my measuring for the depth, and a measuring tape. So first thing I'm going to do is I'm going to take the old dressing out and measure it. While doing so, I'm going to make sure there's no discoloration, no odor, and if I find any abnormal findings, I will report to the doctor and I will chart anything I find. So I'm going to go ahead and remove this old dressing. Going to kind of swipe up and get all that nastiness out. So now I've exposed the wound. I'm going to go ahead and measure. I'm measuring the length, the width, and then the depth. I will take my Q-tip, stick it as far as I can, measure my thumb, and then put it with the inches on the ruler. So now that I have measured my wound is now open. I'm going to go ahead and set my sterile field up. So I will discard these gloves. I will go wash my hands. So while setting up a sterile field, I'm going to go ahead and open this gauze. And then I'm going to lay my sterile field out, only using the 1-inch margins provided. So I'm going to go ahead and remove my gloves and place my gauze to the side. So, without breaking sterile technique, I need to wet my gauze for dry to damp wound. So, I'm going to go around, making sure not to reach over it, and wet my gauze, not touching the sterile field. So now that I've done that, I'm going to go ahead and place my sterile gloves on. Only using the 1-inch margin again to open them. Take my first glove and my second glove, making sure not to contaminate them. And now you can fix this one. So I'm going to just throw this in the trash, not touching anything. I am still sterile. So I'm going to open my packing stick, my abdominal gauze, my betadine, or whatever you may be cleansing with. Alright, so I'm still sterile at this time. So I'm going to take one stick, clean the edge, and throw away. Clean this edge and throw away. And then I will go down the middle and throw that one away. So now I need to pack my wound. So with my still sterile hand, grab my Q-tip, and with the sterile hand, I will grab one gauze. You want to make sure to kind of, when you start packing it, you don't want to put it just straight in there. You kind of want to unfluff it. So, gonna pack my wound that is moving and will not stay still. I would use 2 4x4s if my wound was bigger, but my wound is small and will not hold 2. Still keeping this hand sterile. I have not touched the wound bed. Making sure it's in there. Not touching the outer edges, just on the inside. Alright, and then I will discard this. So now, I will take my dry gauze with my clean hand, 2 4x4s. Clean hand, abdominal pad. And then I would tape it at the top, the bottom, the sides, and then I would evaluate my patient, make sure he's comfortable, document any findings I had, and document the dressing I have done. I would discard these gloves, wash my hands, and make sure all patient safety is put in place, lowering the bed rail and placing the call light.